When seeking prior authorization for specialized medications like Ngenla, it's not uncommon to run into a few obstacles. Healthcare providers, patients, and office staff alike can face challenges, especially since each insurance company, whether it's Aetna, UnitedHealthcare, or Cigna, has its own unique processes and criteria for approval. But don't worry, with a little bit of understanding and preparation, you can make the process much easier. Let's walk through it step by step, and by the end, you'll feel more confident handling prior authorization requests for Ngenla. The first thing to keep in mind is that understanding the insurance company's requirements is absolutely key. Providers like Aetna, UnitedHealthcare, and Cigna may have different processes for covering medications like Ngenla, which is a long-acting growth hormone therapy used for pediatric patients with growth hormone deficiency. Insurance companies usually require prior authorization for Ngenla due to its high cost and specialized use. The request will often be evaluated based on medical necessity, patient medical history, and the guidelines specific to that insurance plan. That's why getting familiar with each insurer's specific requirements up front is so important. So why does Ngenla need prior authorization in the first place? It's a specialized treatment for conditions like growth hormone deficiency, and insurance companies want to ensure that it's medically necessary and being used appropriately. Prior authorization helps confirm that this treatment is truly the best option for the patient, while also ensuring that healthcare resources are being used responsibly. If you follow the right steps, you can easily get the approval you need. Now let's dive into the step-by-step process to secure prior authorization for Ngenla. The first thing you need to do is understand the insurance coverage. Take a good look at the patient's insurance policy to see what the criteria are for covering Ngenla. Some insurance companies may require patients to meet specific diagnostic criteria or try other treatments first. Make sure you also know if there are any special forms or procedures to follow when submitting the request. Once you have that covered, it's time to gather the essential documentation. This is where the healthcare provider plays a major role. You'll need to put together a comprehensive package of supporting materials. These could include diagnosis records for growth hormone deficiency, growth charts, medical test results, and any past treatment history, especially if other treatments were unsuccessful. The more thorough the documentation, the stronger your case will be. Once everything is gathered, it's time to submit the prior authorization request. Usually, the doctor's office will take care of this part, but you'll need to ensure that the correct insurance prior authorization form is filled out and all supporting documents, like lab results and growth data, are attached. Accuracy is key here, so double-check everything before submission. Now that the request is in, don't just sit back and wait. Make sure to follow up with the insurance company to confirm they've received the request and ask about its status. It's amazing how much a quick follow-up can speed up the process. Staying proactive ensures that you don't lose any time and can get a decision more quickly. But what happens if the request gets denied? Don't panic. Denials are part of the process, but you can often turn them around with the right approach. The first step is to carefully review the denial letter to understand the reason. Common issues might include missing documentation, incorrect coding, or not meeting the medical necessity criteria. If that's the case, you can prepare an appeal by providing additional evidence, whether that's updated test results, more detailed patient history, or peer-reviewed studies that show Ngenla's effectiveness for the diagnosis. Many times, appeals succeed when there's clear and compelling evidence to support the need for the treatment. And don't forget, using the right ICD-10 and CPT codes can make a big difference. For instance, ICD-10 codes like 𝗂𝗎 for hypopituitarism or E34.3 for short stature, due to endocrine disorder, along with CPT codes like 96372 for injection administration, are important to get right in order to avoid delays or denials. Managing this process can be time-consuming, but with the right systems in place, it can be done efficiently. Services like Staffingly, can help ease the burden of these administrative tasks by handling insurance verifications and prior authorizations, so you can focus more on patient care. Remember, the key to success with Ngenla prior authorization is preparation. Gather all the necessary documentation, follow the insurance requirements closely, and stay persistent. And if you need support along the way, companies like Staffingly are ready to assist, helping you navigate the process without the added stress. With these tips in hand, you'll be ready to handle Ngenla prior authorization like a pro, ensuring your patients get the treatments they need without unnecessary delays.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.